Postnatal depression is one topic women mostly shy away from, and those who suffer postnatal depression hardly speak out because of stigma attached or because of fear of being discriminated. So today let's look at postnatal depression, the causes, the symptoms, and what to do to help yourself if you find yourself having postnatal depression after delivery. If you're suffering from postnatal depression, just know it today that you are not alone. 1 out of 10 women after delivery suffers postnatal depression, and this depression comes 1 year after delivery. Welcome to my YouTube channel. This is Midwives for All channel. Here we are with you throughout your pregnancy journey. If you have not subscribed to this channel, like you are coming across this channel for the first time, please subscribe and like and drop a comment. If you are a returning subscriber, thank you for staying here. Postnatal depression is also known as postpartum depression. This is a mood disorder that affects many women after giving birth. Causes and risk factor of this postnatal depression. Causes is known to be due to hormonal changes after birth. During pregnancy, our body goes into immense changes, hormonal changes, hormonal fluctuation and all that. So after delivery, this tends to trigger depression for some women. Another causes of postnatal depression is sleep deprivation. During pregnancy, most women don't sleep enough, and after giving birth, taking care of the baby, trying to adjust from being pregnant to motherhood, waking up at night to attend to baby's need, all of this puts strain on your body, and this triggers depression for some women. Then emotional stress relating to parenting responsibility, just like I've said, or a history of mental health issue in the family. All this can bring about postnatal depression. And there are some factors that can make one to be predisposed to developing postnatal depression, like lack of support. After giving birth, you don't have anyone to support around the house. You see yourself being overwhelmed with responsibility of parenting, especially when it comes to newborn. Taking care of newborn is demanding on its own, and you have other responsibility at home to take care of all alone. This can predispose a woman to developing postnatal depression. Financial strain can also predispose one to developing postnatal depression. The traumatic birth experience is also one of the predisposing factor of postnatal depression. Now, what are the signs of postnatal depression? What can you see to know you are going into postnatal depression, or your friend or relative is going into postnatal depression? Signs of postnatal depression include persistent sadness, low mood, lack of enjoyment. What you find enjoyable is no longer interesting to you. You don't enjoy it anymore. This is sign of postnatal depression. Always tired, you're finding it difficult to sleep or fall asleep, and you are having this frightening thoughts of hurting your baby. Please, this is a sign of postnatal depression, and you need to seek for help immediately. Do not hide it, or do not try to bottle it up all on your own, because the treatment for postnatal depression is support, and this has to start when you identify yourself being in need to receive this support. But that is seeking help earlier enough, and this is very crucial. Treatments include self-help, such as talking to family and friends, talking therapy, and behavioral therapy, and in some cases the doctor might prescribe medication. That is when the postpartum depression is severe. Doctors will prescribe some medications for you. Eating healthier, exercising, and drinking enough water can also help you if you are suffering from postnatal depression. Just make sure you eat well, and also make sure you have enough support around the house. This will also help you to come out of postnatal depression. In all you do, just make sure you are asking for help and you are seeking for support. Don't take it all alone. Speaking out is the beginning of your healing process. Remember, you are not alone when it comes to postnatal depression. Always reach out to your doctor or your midwife or someone you feel that can be of help. This is very important because untreated postnatal depression can make you continue to feel guilt. You might even think you are not doing what you're supposed to do. You might even think you have failed yourself and you have also failed your baby. So this is why you're supposed to see a doctor for therapy, because what is happening to you is not your fault. If it's due to hormonal changes, it is not your fault. You'll be made to know that once the hormones stabilizes, you will be fine. So talk to someone today. And then if you are a partner and your wife, after giving 1 year after giving birth, start showing signs of postnatal depression, please try as much as you can to provide support around the house. Do the house chores you can so that your wife will have enough time to rest. And also try to encourage your wife to speak out and seek for support, and be empathic towards your wife, because during this period the wife is going into a challenging time. So always remind your partner that they are not alone in this struggle. And remember, supporting your partner with postpartum depression requires compassion, patience, and active involvement. If your wife have an appointment with a doctor, please make out time to also assist and escort her to the doctor for the appointment, and provide all the necessary support and help. Thank you for listening, and I hope you find value in this video. If you do, please do well to subscribe to this YouTube channel if you have not, and like my video. Thank you, and see you next time in my next video. Stay positive and stay healthy. Bye.